Now, there's 250 miles between Bournemouth and Manchester. Now, that's quite a distance to travel to visit your teenage child in hospital. But that can be the reality for the families of youngsters who require psychiatric intensive care because there's nowhere for them to be treated in Dorset. So, could plans for an 8-bed inpatient unit locally be the answer? Edward Salt reports.
When I was a teenager, I was struggling with an eating disorder and self-harm. I know that my school were quite concerned about my suicidal thoughts.
Chloe was treated in a psychiatric intensive care unit, but that wasn't in Dorset, but in Colchester in Essex.
I just felt isolated and like I was on my own because I had no one around me.
I couldn't give her all the support that she needed. To have your daughter so many miles away, crying on the phone, "Mum, I need you, I need to see you, when are you coming to see me, I need to go out." It was soul destroying.
Now there are plans to knock this and another building down to make way for this, meaning young people like Chloe can be treated closer to home.
We are hoping to build an 8-bedded psychiatric intensive care unit for children and young people. At the moment, if young people have this kind of condition, they're having to go miles and miles out of area, as far away as Manchester, but on average it's about 91 miles away that they'd be accessing this inpatient care. So for us it will mean that actually people can get the care locally where they need it, close to family and friends.
And Naomi knows how important that is. She was admitted under the Children's and Adolescent Mental Health Service in Dorset, but fortunately her treatment meant she didn't need to travel away.
I felt really, really lucky because it was so close to home. It was only half an hour away for my family to drive to come and see me. My friends could come and see me, and it meant that I was able to remember my reasons to keep fighting and who I was keeping going for.
These proposals will now go before BCP Council for a second time. If given the green light, this unit could be fully up and running by autumn 2025. Edward Salt, BBC South Today in Bournemouth.